My name is Jatisse Few, and this is my presentation on exceptionalities and universal design for learning. So we went over 11 different categories of exceptionalities over the course of this semester. So I'm going to do a brief overview of those different categories. So a learning disability is a breakdown between a student's ability to listen, think, speak, read, write, spell, or do mathematical calculations. So it's the most prevalent category, with about 35% of students who receive services are labeled with a learning disability. So there's a wide range of different levels of academic achievement that students can have. So they will usually have strengths in some areas and lows in some others, and no two students have the same level of strengths and weaknesses that would cause them to have a learning disability. It's basically a challenge in how does a student take in new information, process it, and be able to spit it back out. There's a couple different ways that you can get diagnosed with a learning disability. It used to be a straight IQ test and an academic achievement test, but schools are trying to get away from that and trying to focus on the process of these are the things you struggle with, these are the things that we're trying to do to help you with those struggles, and how is it working? And you get to a point where you can then diagnose with a learning disability if a lot of those things are not working along the way. So then there's different speech and language disorders, which is basically a breakdown in the way a student can communicate with other people. There's different, speech disorder is an inability to, like, you struggle with making the sounds, or your voice quality is impaired for some reason. A language disorder is, there's two different types, either receptive, how do you take in information, and expressive, how do you spit that information back out. About 20% of students who receive services do so with a speech and language impairment. A lot of times, the speech services are reserved for younger students who are about 3 to 6 years of age. And as they grow and they mature, they usually age out of those services. Emotional and behavioral disorders is an inability to have healthy relationships with those around you. You struggle with being able to show appropriate responses to circumstances. You are show depressive symptoms, or you have irrational fears to certain things. About 5.7% of students who have an emotional and behavioral disorder receive services under IDEA. You usually have a DSM-5 diagnosis from a medical doctor. And then the school psychologist would use different scales to see how do those symptoms affect the student's learning. There's two different types. Usually there's externalizing behavior. The behavior is focused outwards on other people around you, which is usually seen in male students. Or there's internalizing behavior, where it's bottled up and you keep it inside, and that's usually seen with female students. Attention deficit hyperactivity disorder is something that is that's covered under other health impairment category. It's not just a problem with the student's attention, their hyperactivity, or their inattentiveness. It's a breakdown in their executive functioning system in the brain. It requires a DSM-5 diagnosis, and then also scales that are geared towards ADHD are given, so you can see how the student's learning is affected. Intellectual disabilities are a student has to have a sub-average intellectual functioning, but also struggle with using the skills that they do have in adaptive ways. Do they struggle with generalizing skills from one area to another? Intellectual disabilities are, you have to have a lower intellectual functioning, but also lower adaptive skills. Autism is another DSM-5 diagnosis, and it's associated with repetitive activities, or resistance to transition from one category to another, to changes in your environment, and unusual responses to sensory stimulation. Usually it's you don't want the sensory stimulation, but sometimes some students would want too much sensory stimulation. There's also about 9.1% of students who receive services do so with an autism diagnosis. And then multiple disabilities are students who have issues that are like multiple disabilities that work together to affect their educational needs. So about 2% of students qualify with multiple disabilities. Then there's traumatic brain injury, which is something that is acquired. You can't be born with it. And so a student would receive an injury to the brain that is either an open head injury, which your skull is broken open in some form, or a closed head injury where the skull is not open, but there's definitely damage to the brain, and then your executive functioning system is damaged. And so students who have a TBI they need to be reevaluated on a regular basis, because as that brain heals, their needs are going to change, and sometimes it can happen very quickly. So physical disabilities are something that affects a student's motor functions. So something like cerebral palsy or spina bifida, and about 1% of students are affected by, are diagnosed with this category. The hearing impairments have to be diagnosed by an audiologist, and so an audiologist will do a screening or a test to see if there's any hearing loss, and then to what degree there is loss, and then that way they can evaluate what does a student need. How can we help them to be able to stay in the classroom and be able to hear what they need to hear? Visual impairments are, there's different levels of visual impairments. A low vision impairment means that the student still has some sight. They can probably still do some of the reading in the classroom. They just might struggle with a little bit more. They might have some thick glasses or magnifying lenses or some other help to do that reading. A functionally blind student is more likely to will have less vision, and so they're more likely to focus on learning to read Braille. And a totally blind student does not receive any visual input at all for the most part. And so they are going to need different, based on their level of vision, they'll need different services in the classroom to stay in the classroom as much as they can. Gifted and talented students it's something that's not federally regulated by IDEA, but the states will try to include it when they can. And so it's something where they're trying to get towards looking at multiple levels of intelligence. What are the strengths and weaknesses of students? And so it used to be that you were originally, like, it was just a strict, how did you score on your intelligence test? And that's how you were placed in the gifted program. Schools are trying to get more into that RTI, where, what are your strengths? What are you really good at? What can we support you with? So the universal design for learning is something that started out as something that teachers could do to include exceptional students in the classroom. But what it turned into was a unique combination between education and neuroscience, and it's something that can benefit all the students in the classroom. And so it focuses on three main principles: multiple ways of engaging, multiple ways of representation, and multiple ways of action and expression of those things that you're teaching in the classroom. So you first want to establish clear outcomes. What are the goals of the assignment? How can you help students meet those goals? How do they align with the standards that you're trying to meet? How will you teach those goals, or how will you communicate those goals to your students? So you will want to anticipate the variability that comes with your different learners in your classroom. So what are some of the barriers that your students are going to come in with? They can be physical, social, cognitive, or cultural ability. Just something like what do you already know is going to be an issue that you can try to head off before it becomes an issue? Consider the strengths and weaknesses of the kids in your classroom and try to play off of those. So how will you measure your outcomes? So how are you going to know if you met those goals? You'll want to find different ways to engage in that information. Instructional experience this is where you do your detailed lesson plans. You'll want to come up with as many ways to engage that information as possible. What is your plan of instruction? What are your intentional ways that you are going to try to impart that knowledge? So you'll plan out the students, or the materials that you'll need for each of your students. How are you going to come up over those barriers that you've already decided may or may not be an issue? Create high expectations and figure out how to create a plan of action to help those students meet those expectations. Reflection and new understanding. So when you're done with the teaching with a lesson, go over and say, how could you have done that better? What helped the students the most? What didn't really work? What can you tweak for next time? What did the students meet those goals, and what can you do to help them meet them even more? And so basically, universal design for learning it's about how you set up your classroom. How do you plan on teaching students the knowledge that you want to impart for those standards to meet for each year? It creates opportunities for intentional learning. It's not a passive thing. You are purposely going out and finding ways to get those students engaged. They become motivated, resourceful, and strategic.